What if I told you that you have the power in your own hands to prevent yourself from becoming ill? Hand hygiene is one of the easiest and most simple ways to prevent illness in yourself and in your family. Hand hygiene should be performed frequently and thoroughly throughout the day. Now, would you believe that only 5% of people wash their hands correctly? 7% of women don't wash their hands after using the restroom. 15% of men don't wash after using the restroom. And 39% of people do not wash their hands after blowing their nose or coughing or sneezing into their elbow. Now, these aren't the only times we should be washing our hands thoroughly and effectively. The CDC says these times we should also be doing it. Before, during, and after preparing food, before eating, before and after caring for someone who is ill, before and after caring for a wound, after using the toilet, before and after changing diapers, after blowing your nose, coughing, or sneezing into your hands, after touching animals or their waste, and after touching garbage. Now, there are some easy steps to follow to wash your hands thoroughly and correctly. First step is to turn on the water, get your hands wet. Now, the temperature needs to be what we call tepid, not too hot or too cold. An article from the Journal of Occupation and Environmental Medicine stated water temperature alone has not been shown to be effective in reducing bacteria. The second step is to apply your soap. Now, an article found in the Clinical Infectious Disease on Antibacterial Soap has not been shown to be more effective than regular soap at reducing bacteria as long as they're being used correctly. So just a regular plain soap and water does the job. Now, that time should be 20 seconds. You should get your back of your hand and your thumbs while you're doing this. Sing happy birthday twice, because that's about what 20 seconds would be. Now, the next step obviously is going to be to thoroughly rinse your hands, and that will release the bacteria and send them down the drain. Now, the fourth step is to dry your hands. Now, an article found in the Journal of Infection Prevention stated a clean towel is best for reducing bacteria, as hand dryers tend to spread more germs. Now, there is a special chemical that we use that simulates bacteria. So when you put that on the hands, it'll glow under black light, and you can see the results here. Now, there's a big difference between just rinsing and shaking compared to a full 30-second soap and water. And as you can see, the longer you wash and the more the pseudobacteria has been reduced from the pictures. Now, hand sanitizers, they can be used, but only use these when soap and water are not available because they are the best choice. Now, an article found in Infection Control and Hospital Epidemiology stated that alcohol-based hand sanitizers are not effective at killing spores such as C. diff. Now, C. diff is a spore that causes diarrhea symptoms and usually has to be treated in a hospital, so it can be pretty serious. Now, this slide here shows the difference between an unwashed hand with that pseudobacteria again, compared to hand sanitizer and soap and water. And as you can see, the soap and water is clearly a better choice at reducing this pseudobacteria that glows under the ultraviolet light. Now, many items that we touch every day are very contaminated, and our food is a very easy way to get those sources into us, make us sick. That food also is a great medium for bacteria to grow. So what you can clearly see in this is that dirty hands are absolutely going to grow bacteria on something as simple as a slice of bread. And the hand sanitizer, you can tell, actually does reduce quite a bit of that bacterial growth, but nothing compares to that soap and water, which is actually almost as clean as the untouched bread. Now, there are several illnesses that are prevented by hand washing. Many are gastrointestinal illnesses such as norovirus, salmonella, E. coli, typhoid, cholera, shigellosis, and now there are also respiratory illnesses that are associated with these bacteria as well. And those are adenovirus, hand, foot, and mouth, strep throat, scarlet fever, pneumonia, influenza, and COVID-19, which is very relevant to this day. So there are also some very interesting facts about germs. Germs can survive 3 hours on your hands. There are 2 to 10 million germs located between your fingers and your elbow. Number of germs can double after using the toilet. Wet hands spread germs 1,000 times quicker. One germ can multiply into 8 million germs by the end of the day. 80% of illnesses that we suffer are due to our hands and contamination. The remote control in our house is the top carrier, being the most contaminated item we have. There are more germs on your cell phone that you have in your pocket or your hand than are on your own toilet seat in your house. Now, if you carry a purse, they have 10,000 bacteria per square inch. Now, what these studies have clearly shown is that washing your hands frequently does reduce the chances of you becoming ill. It reduces the bacteria. It is the easiest way to reduce those bacteria. Soap and water have been shown to work far more effectively than any type of hand sanitizers. Make sure you wash them for 20 to 30 seconds. Dry them with a towel. You can use hand sanitizer if soap and water are not available, but remember, it has to be 60% alcohol and they do not kill spores. You'll have to wash your hands with soap and water for that 30 seconds to release the spores, to get those to go down the drain. And you can keep you and yourself family by just following these simple techniques.